All right, so we're recording. Hi, I'm Tracy Spackman. I own Get Quiet Nights, and I'm a gentle sleep coach. I have created this presentation for you. It's called 5 Truths and a Lie About Baby Basics. My kids really liked that title, 5 Truths and a Lie. My daughter said it's 3 truths and a lie, or 2 truths and a lie. I'm like, yeah, but I have so much more to share. So I had five truths and a lie. So here, I'll share my screen with you. And can you see my screen? Yes, okay.
Yes.
And I can still see all of you, which I love that about Facebook. I just have to make that part bigger so I can continue to see all of you. I like to see who I'm talking to. It's almost like talking in person. Okay, so 5 truths and a lie. My Facebook group, which you're all welcome to join, is called Sleep Sisters Get Quiet Nights, because women need women. Don't you think that we all need each other? And so It's kind of like a sisterhood of helping each other out, how sisters help each other. But then some people misconstrued what my group was about when I just called it Sleep Sisters. And I got some crazy requests. So I had to rename it. I know, right? So I had to rename it. Had to put my Get Quiet Nights in there, so it was more obvious that it was for women and sleep and babies. So now it's called Sleep Sisters Get Quiet Nights. And I have a group that is just, and it's international. I also have a group that is just for Arizona people, and it's called Sleep Deprived Crazy Mamas of Phoenix. Because you know, I like fun names, right? So you're welcome to join both of those, but the Sleep Sisters Get Quiet Nights is international, and it's where it's a mom-to-mom support group, and people tag me all the time to answer their questions. And so you're all welcome to do that. And I'm hoping to share this presentation. I'll just post it afterwards. So I polled them. I said, what are some things that you wish that you had known when you're pregnant before you had a baby? And I got some really great answers. I tried to incorporate all of them as the truths. And then I said, so what are the lies? So you'll find out what the lie was at the end. We'll do that one last. Okay, so number 1, the first truth is there is a 4th trimester. So you have the 3 trimesters that you're pregnant, and then there's a 4th trimester. So have you heard of that before? Like, raise your hand if you've heard that concept before. So important. Everyone needs to know that there is a 4th trimester. So after your baby is born, there's like another 3 months that is kind of like being pregnant, where you keep your baby on the outside of you, but right next to you as much as possible. And there's a lot of things that happen. So the 4th trimester, the 3 months, 12-week period after you have your baby. This is one of the things that I didn't know when I had my first baby. When I first heard that concept, I'm like, oh yeah, that makes so much sense. Yeah, 4th trimester, where you're kind of skin to skin with your baby all the time. It's a time of great physical and emotional change as your baby adjusts to being outside the womb, and you adjust to your new life as a mom. So one of the people in one of the moms of my group, she said specifically, and I'm quoting her, she said, I wish someone had told me that the 4th trimester is a real thing, and it will drain you and test you, and you will most likely cry. It will have wonderful ups and downs, wonderful ups and bad downs. You'll be tired, and you'll question if you are doing a good job. You are doing a great job. She put that in all caps. You will look back on those times with fond memories, and it will go quick. It doesn't feel very quick when you're in it, though. Your baby needs you, not a clean house or folded laundry, but a healthy you to just love them. So true. So when people ask you if they can help, and maybe you're in a community where people are offering their assistance, accept all offers of help, and have them wash your dishes, and fold your laundry, and hold your own baby. They think, I'll come over and hold your baby to give you a break. But that's not really the best for the mom-baby dynamic. As a mom, you will feel more relaxed knowing where your baby is and that your baby is safe and comfortable, and your baby will feel more relaxed in your arms. So you actually get more of a rest if you can just hold your baby, let someone else do the dishes, the laundry, the sweeping. So if you have anyone asking for that, take it. Yes, Carolyn.
Do you mind if I take a picture of that quote? I just love that, and I'd love to look at that when I need that reminder again.
Sure.
Thank you.
You can screenshot it because I'm going to post this whole presentation in my Sleep Sisters group. I'll upload it to YouTube, and I'll share the link with you. You guys can go back and watch it and share it with your friends. Okay, so fourth trimester. And there were some really funny things about the fourth trimester that I thought I had to share with you because these are all true. Okay, so the spray bottle process you have to go through after going to the bathroom is kind of ridiculous and genius at the same time. They give you this little bottle that looks like a sport top water bottle in the hospital. You're like, why do I need this? You totally need this. There's some bleeding and discharge, and it's uncomfortable, and you need this bottle, and you want to keep it full and keep it in the bathroom. It's genius. Okay, number 2, emotions are still crazy. You know how you cry a lot when you're pregnant and it's just because your hormones are going crazy? Still happening in the fourth trimester, your hormones are still going crazy. So like random things, like she says a Pampers commercial makes you cry. Totally, yes, commercials make you cry. The last cookie, the fact that your baby doesn't need newborn size diapers anymore. It's like, my little baby's growing up. You want to cry. Your hormones are going crazy. But number 3, you will get poop on you. More than once. There's poop everywhere, all the time. Your baby will pee on you. Poop goes right in the back, everywhere. So keep an extra t-shirt in your purse at all times and a gallon-sized Ziploc bag that you can put your poop-covered clothes onto and change your shirt. I used to keep an entire outfit for myself and for my baby. And I would go to church in the diaper bag. And one time I left my church class and I came back in a whole new outfit. The baby was in a new outfit. Everyone's looking at me like, you changed? I'm like, boop. These are real things. You will have conversations about the color of your baby's poop, and this is totally acceptable. Yoga pants are for life. I'm totally a jeans girl, but yeah, your jeans don't fit after you have a baby. And you don't want to wear your maternity jeans, even though they're really comfortable after you have a baby. That always feels weird. I had my first baby was just a few weeks old, and I was somewhere where there was like lots of like muscle men, so like a motorcycle repair place is where I was, paying for my husband's motorcycle fix or something, and I still looked very pregnant, and I just had a baby, and then one of the guys like, make way for the pregnant lady. I'm like, oh, I just had a baby, but I'm like, just won't say anything. It just happens. You still look pregnant after you have a baby for a little while. It's normal. Give your body some time. You will still glow, and people will pay more attention to your baby than great. It's fine. Your boobs may feel like they've been injected with cement, and all of a sudden it may seem quite reasonable to stuff your bra with cabbage leaves. Have you heard that? Cabbage leaves? These are just the weird things that happen in the fourth trimester.
Yeah, I tried that one, cabbage leaves. That was definitely something I did.
Did it help?
No. It
You
did
don't
not.
have to try crazy things.
Black tea bags work really well.
Really? Wonderful.
Yeah,
Good to
black
know.
tea. Steep it like you're gonna drink it. Get it cool enough to your touch, and put it on there, and it's great.
Huh.
Oh, nice.
One of my postpartum nurses taught me that the first time.
Not
Very
something
good to know.
That's not intuitive.
Yeah, I know. It's good.
I'll add that to my notes.
Yeah, thank you.
Thank you.
Prepared for leaking circles. My sister-in-law tells this story about she had to give a talk in church, and she had a new baby, and she gets up to give her talk, and there are these 2 big wet circles just right on her blouse like that. She just gave her talk. She's like, whatever. These things happen. Extra t-shirt, Ziploc bag in your purse. You have to be prepared because these things happen. As soon as you get emotional or you hear your baby cry, it just let down. It just happens. So be ready. You may stress over the umbilical cord. This is normal. Feels strange. You're like, is it supposed to come off? Did I clean it well enough? It's still there. It's normal. Don't worry about it. Just go with the flow. You may quickly realize that your new sleep patterns don't involve a REM cycle so much as a wake up a million times a night to make sure that their breathing cycle. If your child is waking you up a lot, that's normal. But waking up to check that they're breathing a million times is actually not normal. That's excess worry a few times, because babies really, when they breathe, it's silent. You should not be able to hear them. Their mouths shouldn't be open. You can't really tell that they're breathing. But if you're worrying about it a lot and it's keeping you up, that might be a sign of postpartum depression, which we're going to talk about a little bit. Let's see, not wanting to go outside with your baby because it's totally scary is totally normal. And then finally going out with your baby and feeling free is totally normal. The whole gamut of the hormones. I got another page of this. Okay. Babies' poop can explode all the way up their backs. Laugh. It is funny. And it doesn't actually smell that bad. Toddler poop, that's the worst. But little baby poop, not so bad. That's mine. Your baby might want to nurse for 30 minutes on each breast every time she nurses. So fire up the Netflix and binge watch something, or listen to a podcast. If you listen to a podcast, then you can look into your baby's face, and then it's attachment time. So when a baby is sucking on something and you're looking into their eyes and having some sort of interaction, that fosters attachment. So it's even better. I didn't have podcasts or Netflix when I had my first babies, and so I'm trying to hold my baby and hold up a novel and read it in like low light. So I'm like, podcast, it's the best. You get to feel like you're multitasking. Babies grunt a lot. They make a lot of these tiny little noises. That's normal. And it's really adorable. And they're supposed to sleep with their mouths closed. So if your baby's asleep like this, close their mouth and see if it stays closed. They're supposed to sleep with their mouths closed. So if their mouth is always open and they always want to sleep with their mouth open, that's a red flag for tongue tie. So go get that checked out to make sure that their tongue, your hair, that's all loose, so that their jaw can grow forward where it's supposed to have enough airway back here. So babies breathe with their mouths closed, and then they're supposed to breathe through their noses. You may be confused or a little terrified of cradle cap. They get all this red stuff up here, and you want to pick at it and pull it off and think, oh, my baby has acne, or maybe I think I'm not washing them well enough, and you want to scrub it. You don't have to. It's normal. You put a little bit of baby oil on it, or just leave it. It does go away. A lot of us didn't realize that newborn babies get pimples. Babies get pimples. It's kind of fascinating. You suddenly realize how noisy your neighborhood is when you're desperate for the baby to take a nap. Like, everything is so loud. Newborn life will quickly show you that baby wearing is the best thing. I did not discover baby wearing until my 5th child, when I finally decided to buy a really good carrier. 5 children later, and then I get a really good carrier. I'm like, why did I not get this before? You can get them at the secondhand store. They're not that expensive. If you buy them new, they can be expensive, but at a resale baby store, they're usually $30 or less. Totally worth it. And then you can keep your baby with you all the time, and the baby wants to. Let's see, newborn life. Oh, the soft spot on their head right here. That's normal. It kind of freaks you out a little bit. And it will close, promise. The first time that you do a jumping jack or cough or sneeze, you're like, oh, and you just pee a little bit. That's totally normal. But if it continues to happen, don't wait too long before you go talk to someone about it. But at first, it's totally normal because everything is kind of loose down there. But I read that it takes the average woman 7 years to go and talk to a doctor about some urinary incontinence. They've just been putting up with it, and it just gets worse and worse and worse and worse as they get older. And there's this thing called pelvic floor work and pelvic floor therapy. It's because the doctor will tell you to do some Kegels, and you can read all about how to do Kegels to tighten up all of that stuff to help with that. But sometimes Kegels are not enough, and you need to have someone help you with that.
And that's actually what we talked about, ladies, for those of you that were in our class with Kim Bryant with Thrive Physical Therapy. She's a pelvic floor specialist. So her information is on the page too, if you guys need that.
So I'm 49. I have 5 children, and finally I am going to go see someone about this. And it has been like making me crazy for the last 10 years. My youngest is 13. And the last time I was at my doctor last week, because I got pneumonia from a cancer screening procedure, and then complications that end up with pneumonia. So when I went to my doctor, I'm like, and I'm coughing all the time, and it makes me pee my pants, and it's terrible. And he's like, okay, you should do Kegels. I'm like, don't tell me to do Kegels. This is not a Kegels problem. There's more. So like, okay, pelvic floor, what kind of doctor do I need to go see? Is there a physical therapist for this? I'm like, help me. He's like, oh, all right. And he gave me a urogynecology or something. I'm like, I need a serious specialist to help me with this. Because yeah, if you can't do jumping jacks or you can't do a sit up without making it pee your pants, that's not something that you have to put up with. And women, if we talk about it and not hide it, we can be more comfortable with our bodies. Don't wait 7 years. If that's your problem, you find that's one of your problems after having babies, don't wait. If you are breastfeeding, you may feel like you're living your life in 2 to 3 hour increments. So if my baby wanted to eat every 2 hours when he was first born, my first one, girl, when she was first born. And it would take half an hour to feed her, and then she'd fall asleep, and then I knew I had an hour, and then I knew she was gonna be hungry again. So I was like, I time my life in these small little increments. That's totally normal. And then it starts to space out as they get older. But waiting 4 hours between feedings is too long. 1 to 3 hours is pretty common, and the range of normal is pretty broad. So learn to understand what your baby does to show you what their tired signs are, what their hunger cues are. One of the big purposes of this 4th trimester is to figure out your baby, how to get to know your baby, and your baby is getting to know you, so that you can have this symbiotic relationship for a while, codependency. Soak it in. The main purpose is to get to know your baby. And this isn't a time for sleep training. Those first 3 months especially. You may read about these sleep training programs for babies that are 3 months old, and you don't let your baby cry it out at 3 months old or anything that even looks like that. You are trying to figure out what your baby needs. And most sleep problems in this 4th trimester, they're not actually sleep problems. They're usually hunger problems. They're usually feeding issues. So if your baby won't sleep or not sleep enough, or you're going crazy, your baby wakes to eat every hour, it's probably a feeding issue. And please talk to a lactation consultant or someone to look at the latch or someone to look at tongue tie to make sure that everything is fine. It's a lot of coping that happens in the 4th trimester. Think of it as a coping period, not a sleep training period. Okay, truth number 2. Loving and frustrating thoughts, focusing on the frustrating thoughts, they stem from a desire to be a great mom. So this is postpartum depression. Having a baby can be the happiest and most important event in your life. It can be thrilling and rewarding, and it can also be very hard and very stressful. So the baby blues, have you heard of that? I know there's a comic book called The Baby Blues, but I'm talking about hormones and sadness. So 50% of new mothers have the baby blues. It's just sudden mood swings, and it just lasts, sometimes it just lasts for a few hours or 1 or 2 weeks. But when it persists and lasts longer, it's postpartum depression, and it turns into a hormonal imbalance. It doesn't mean that you did anything wrong or you're doing anything wrong. This just happens. Some people are predisposed to postpartum depression because they've had depression before, and depression is a hormonal imbalance. It's not a result of choices that you make. And so it's good to see someone. If you have intense feelings of sadness, despair, or anxiety or irritability, it can actually start anytime in the first year. So you may be totally fine. And then after the 4th trimester, when you thought that it would have happened, you may think you're in the clear. And then at 6 months, it happens that you start to feel really irritable or really sad. And you don't understand why you feel this way. It doesn't make any sense. You might have, some postpartum depression might have kind of crept up and started for you. It affects your ability to function. And without medical attention, the symptoms might get worse. It's really helpful to talk to someone about it, be open about it. If you are having troubling or scary thoughts, if you have thoughts about, what if I drive off this bridge? Oh, I'm so tired. I'll just drive off this bridge. Like, that's just a scary thought. Maybe if I just leave my baby here and I'm just going to walk away and I'll just leave them here and maybe some stranger will pick them up. That is a very troubling and scary thought. These, you have some sort of postpartum depression and you need to talk to somebody about it. I love this picture, the truth about postpartum for many women. Amy Fields from the Arizona Breastfed Babies, she posted this on her Instagram and she said I could share it with you. And these are some of the things that women think. I don't feel like myself. I don't recognize my body. I thought I would feel bonded with my baby right away. No one asks how I'm doing. I have never been this tired. I had no idea that breastfeeding would be this hard. So some of those are just, yes, breastfeeding can be hard, or this woman might have postpartum depression. It would be really helpful to talk to somebody about it. So some of the signs of postpartum depression. My husband tells me that he thought that I had it, but I don't remember. I remember when I look back at having babies, I remember thinking that I was a superhero. I was up with my baby all the time and I was just the best mom and I was so great. And he heard me say that to somebody once. He's like, no, you weren't. You were tired and you were cranky. And I think you had some postpartum depression. You were not a sleep superhero. I'm like, I wasn't? Oh, my perceptions were totally skewed about what was going on. It's a good thing he said it really nicely. I wasn't mad. It was fine. So signs of postpartum depression. So you can recognize it in yourself and get some help if this happens to you. Restlessness, anger, sadness, worthlessness, guilt, fear of hurting your baby or yourself, overly worried about your baby breathing, little or no energy, headaches, chest pain, rapid heartbeat, like panic attacks, trouble sleeping well, poor eating habits, trouble focusing, having a really hard time making decisions, little interest in things that you used to enjoy, like sex. Those can be signs. But you know what's interesting? A dad can have postpartum depression too. Did you know that? It's just a hormonal imbalance from all of these changes, and it can happen to men. It doesn't come from a choice that you made. It comes from a hormonal imbalance that just happens. So 10% of men usually experience some postpartum depression, but you know they probably don't talk about it. So there's no single cause. Physical, emotional, and lifestyle factors, they may play a role, but it's not from choices. Depression also can run in some families. So I think I had some, and I had I was depressed for almost a year. Even before I had babies, I went through a period of depression. So, and I totally remember how I felt with that one. I didn't forget. And the trouble making decisions and everything. And now I think my daughter might be experiencing some of that. So it may run in our family a little bit. So it's good for me to be able to tell her that she hasn't done anything wrong, that this is hormonal imbalance, and go talk to someone. I'll pay for it. I'll pay for your doctor. Go see someone. Lack of sleep, which often happens when you first have a baby, right? Because the baby needs to wake up a lot. That can make postpartum depression worse. But lack of sleep or sleep deprivation also has a lot of symptoms that look like postpartum depression. So if you're not sure, it's usually the difficulty making decisions, harming thoughts, not eating properly. Those types of things are usually more of the postpartum depression rather than just the sleep deprivation. So then once you start to get enough sleep, if all of those terrible feelings don't go away, then you should talk to somebody. And they have done a lot of studies on this. And what was super interesting was one of the conclusions from the studies was that taking the baby away from the mom, you know, to give the mom a break, actually makes it worse, not better. So you think that you're helping the mom by, I'll take your baby and then you can just sleep or you can just relax and I'll take care of your baby. The mom will just worry about the baby. So let them do the dishes and the laundry and the vacuuming and making your dinner. Hold your own baby. It makes it better. All right, number 3. Truth number 3. All babies truly are unique. Why? So this is about temperament. So babies have their own unique set of temperament traits. So I've brought this chart to you. I love this chart. It's from the Child Sleep Institute that they put this together. And there are all these temperament traits. So their activity level, their distractibility, the intensity of their reactions, how regular or predictable are they? How sensitive to things are they? Are they approachable, social? How adaptable are they? How persistent are they? So these are the main 9 traits. That's 9, right? 1, 2, 3, 4, 5, 6, 7, 8. There's probably one more somewhere. These are the most important ones for sleep. So there's all kinds of websites that let you kind of score your baby and their temperament, and it just helps you to understand them. I think it's beneficial to think about your baby's temperament traits, because if you can understand kind of where your baby falls in these areas, it helps you be more patient when it's more difficult. So if your baby is super active, that's good to know. You need to keep them engaged and give them lots of things to do. They're not just going to lay there and be chill. It's something that you should know about your baby. How intense are they? Is your baby a screamer? And that's who they are. Everything about them is like 100%, rather than like just super chill and whatever. These are just temperament traits of a baby. And so if you compare your baby to somebody else's baby, well, why does their baby just sit there and like coo and smile all day? You don't even need to do anything. And mine, if I'm not interacting with them, or if a stranger comes by, they cry. It's like, what's wrong with my baby? Nothing. It's just different. And so figuring out your baby's temperament traits, and that just helps you to adjust your parenting style to meet the needs of your baby. Now, when it comes to sleep, babies that are high activity, highly distractible, very intense, not very predictable, extremely sensitive, needs a lot of time to adjust, so they don't transition in situations very easily, and they're extremely persistent and just have strong will, and they know what they want and hold out till they get it. These babies especially have a really hard time with sleep. And so you can't just try, we'll just do drowsy but awake and a little pat pat shush shush and they'll just go to sleep. It doesn't work for babies that have temperament traits closer to that side. They need a lot more attention, a lot more hands-on. They're a lot harder to figure out, and they actually need a lot more practice at bedtime figuring out how to relax. And they need you to stay with them and kind of do some co-regulation to help them through it. So a baby on that side of the temperament trait, a cry it out type approach, even if it's after 6 months, can cause an anxiety disorder. And I've seen babies where moms have done that and their baby stops smiling. And like, oh, I just broke my baby. Well, you've done something that's caused them a lot of distress, and you can fix it. It's fixable, but you just have to be careful. If you have a baby on this side of all of those temperament traits rather than this side, then I cried out. It's probably not a good idea. I specialize in kids with these alert temperament traits and need a lot of hands-on work to help them learn sleep skills. And so I get it, but every baby truly is unique. All right, truth number 4. Babies are supposed to wake up at night. So especially in the first 4 months, they need to wake up to eat. Their tummies are really small, and how much they get from breastfeeding would depend on the letdown and how fast the flow is and how much fat there is in the milk. And so waking up every 1 to 4 hours throughout the night is normal for the first few months. And it totally gets better. When it doesn't get better, if your baby is 6 months old, still waking up every hour, that is not normal. But at first, those first couple of months, yeah, it can be normal for the baby. How big their stomach is, how fast they digest, how much the flow is, all of those things factor into how frequently a baby needs to eat. And it's going to vary from baby to baby. There's not one formula like how many ounces a baby needs to eat based on their weight. It's not that cut and dry. Babies also need to wake up to connect with their mom or their parent, their caregiver. That attachment relationship is developing, and they need that sense of connections, and they can wake up for that. Pick up your baby if they wake up. Waking is part of a natural sleep cycle. This was from a very sciencey page that I took this from. Babies wake up during the night primarily because their brain waves shift and change cycles as they move from REM sleep to other stages of non-REM sleep. The different wave patterns our brains make during certain periods define these sleep cycles as stages or sleep. As babies move from one stage to another during the night, they transition, and in that transition, they wake up. I call it partial arousal. So if your sleep cycles are kind of like this, and they go up and down like that, then every time it hits up here, it's a transition, and they wake up and have a partial arousal. Everybody wakes up in the middle of the night. We all wake up in the middle of the night, but we are so good, hopefully, at putting ourselves back to sleep that we just roll over, reposition ourselves, and go right back to sleep, and we don't remember. But it's normal. We all do it. But babies are not good at it yet, and so they don't know how to do it. It takes practice. Babies wake up due to lack of sleep hormones and sleep rhythms. Babies don't have melatonin in their bodies. They don't produce melatonin until after 3 months. So if you're nursing, there's melatonin in your breast milk. That helps. If you're not nursing, just wait. It'll happen. It's normal. Babies wake up due to brain development milestones. Have you ever heard of this book, The Wonder Weeks? Yes? Okay. The Wonder Weeks, it's just talking about developmental milestones in the brain, and many of the brain milestones that happen, the brain actually jumps in size. It's super interesting. But there are 4 really big developmental milestones that happen in the first 4 months. and so every time they're going through one of these developmental periods, it lasts a few weeks, maybe 2 weeks, sometimes 4 weeks, sometimes 8 weeks. And it can cause like a stormy period. And the body and the brain is just focusing on these emerging skills that make sleep fall apart. It's totally normal. And they're more clingy. The baby will be more clingy and more fussy. And then the emerging skill will come out, and then they'll be like a little bit more easygoing again. So it just kind of cycles through easy, not so easy, or sunny periods and stormy periods. So there's 4 of them before 4 months. And then once they're through that 4th major developmental milestone, maybe you've heard of it, the 4-month sleep regression. That is a terrible name, the 4-month sleep regression, because sleep falls apart. But really, the brain development is actually so exciting for the baby that it's a huge progression. It's a big piece of progress for brain development. I think they should call it the 4-month sleep progression. But sleep kind of falls apart for a little while. It's normal. Babies who don't wake up at night in those first 3 or 4 months are a much higher risk for SIDS. So those are the babies that are sleeping through the night at those young ages. Those are the ones that the doctors are actually worried about because they're not waking up. So if a baby doesn't wake up easily, if something were to go wrong in their body isn't actually going to wake up and then try to fix itself. If it stays in too deep of a sleep for too long, then that's where the SIDS rate, the sudden infant death syndrome, goes up. So you want your baby to naturally wake up. So there are things that you can do to force a baby to sleep better. You don't want to do them. So sometimes a swaddle forces a baby to sleep better, so you don't want the swaddle to be too tight. They should be able to like, and then break out of it. You don't want a baby sleeping on their tummy will probably sleep deeper. So that's why they tell you to sleep your baby on their back. You want them to be more easily arousable. So if something goes wrong, they will wake up and then the body will correct itself. So I wouldn't sleep a baby on their tummy just because they sleep better. It's not good. White noise machines. I love white noise machines, but they really do help you get into deeper sleep for longer, which is what you don't want for a baby that is under 4 months old. You want that baby to wake up naturally. So keep white noise machines to a minimum and use white noise. And when the baby is over 6 months, then the risk of SIDS goes way down. And then you can play with things like pink noise or brown noise, and they really do help. I have this brown noise app on my phone. It's called White Noise. The app is called White Noise. It's hot pink. It has like these jagged lines and then some stereo bars on it. It's free. There's a free one. It's called White Noise Light, I think. And it has a setting in it called brown noise. And if my husband starts snoring, I can turn it on and I can easily go back to sleep because it really does something to the brain to help you get into deeper sleep cycles for longer. And your brain tries to shut out that sound, and then it shuts out the snoring. So you don't want that with a newborn baby. You want them to wake up. But if your husband is snoring, brown noise, it's really helpful. And if your baby is over 6 months, then you can play with pink noise or brown noise and some of those more deeper white noise type sounds. All right, truth number 5. Hold on until 5 months and things might get easier. They might. But those first 5 months, there's so much that is happening with the brain development in that it's a coping period. It's not a changing period. You don't try to change your baby, accept the baby that you have, barring the weird things like breathing with their mouth open, or if they're still waking every hour at 5 months, that's a little weird. But all these other things they're normal. And so if you have to use motion, baby wearing, or anything else that helps you to cope to get to that point, it's a coping time. Do whatever it takes to help your baby and yourself get enough sleep. Here's a number for you: 5.5 hours. You want to get 5.5 hours of sleep yourself, even if it's broken up. So in a 24-hour period, if all those little chunks of sleep, your 2 hours here, your hour there, 4 hours here, you want to all to add up to at least 5.5 hours. Hopefully more, hopefully a lot more. But if you don't get at least 5.5 hours, then it's really hard to feel sane and your perceptions become skewed. And if I could use a politically incorrect term and say that you start to show signs of crazy, but really your perceptions are skewed and you might forget your baby in the car, leave without your keys, drive through your garage door without opening it, run through red lights. Like you just don't think straight, and it's not safe. If you aren't getting at least 5.5 hours, don't leave your house. I forgot my baby in the car. When I wasn't getting enough sleep. We all went to Dairy Queen, and it must have been 10 minutes for a month. Where's the baby? I left him in the car. I drove to pick up my other child the day after I got home from the hospital. My child was at a babysitter's, and I got in the car and I drove to the babysitter's to pick up the child. And as soon as I pulled up in front of my friend's house, I'm like, oh, I forgot my baby. And I had to like turn around and go home, like he was asleep. But my perceptions were so skewed that you do things like forget your baby. And so I got the baby, put them in the car, and I went back to my friend's house, and I got the baby out of the car. I went to pick up my child from my friend, and she's like, what'd you forget? I'm like, the baby. These things happen. And thank goodness nothing bad happened. And I can use these as examples of what not to do. And please get 5.5 hours of sleep or more. Let your husband help. Let them take a turn. Take advantage of feeding sessions to make eye contact and connect. We talked about that. This is super interesting. Pretend all of those cute little cooing sounds as the baby is playing with their voice and making sounds, and they like to hear themselves make sounds. Pretend that your baby said something intelligent. And then respond to them as if they said something intelligent. Oh, you think my hair is pretty today? Thank you. I think your bald little head is so cute too. Oh, you think my blouse is pretty? Oh, thank you. Oh, you like those carrots that we had? Oh, you think I smell good? So you pretend that you're having a conversation with your baby with their little cooing sounds, and it starts to develop the cadence of a conversation. So as they learn to talk, there'll be this back and forth naturally because of the way that you treated them when they were starting to make sounds. And then they learn their conversational skills and vocabulary and that interaction a lot faster. This one that I learned, this last one is super interesting. You know how when you see a baby, you want to talk to them in that high-pitched voice? Oh, you're so cute! Or peekaboo! You know, you have this high-pitched voice, and then you see someone else looking at you like, oh, I mean, peekaboo. Well, I'm going to be the mom that always talks to my baby in an adult voice. I'm never going to baby talk to my baby. I've heard people say that before. I'm not going to baby talk to your baby. Wow, speaking in that high-pitched voice, peekaboo, oh, you're so cute, stimulates their brain development. So don't stop yourself from doing that. It's really healthy to speak to your baby in that high-pitched voice that you want to do. Most of the things that you feel intuitively that you want to do are good for your baby. You want to pick up and hold your baby when they cry. That is good for your baby. You can't pick up your baby too much. You can't spoil your baby. All of that deep connection and snuggles that you give them is just helping them to have a firm, solid sense of security, which is foundation for all future growth. So if a baby is crying a lot or seems like they need to be picked up a lot, they probably have some of those temperament traits where they need more attention. They need more holding. Your baby's telling you that they need it. And intuitively, you probably want to pick them up. And it's the voices from outside that you think that you shouldn't be, but you should be. If your baby has those extra needs and you don't give them that extra attention, their potential actually plummets. It goes way down to the floor. But if your baby is asking for all that extra attention and you give it to them, their potential actually is higher than the baby who doesn't ask for a lot of attention. So let's say here is the baby that doesn't ask for a lot of attention. And here's the baby that asks for a lot of attention and you give it to them. This is their potential. It's higher than the regular baby. And then if the baby that needs a lot of attention and you don't give them the attention, their potential is down here. It can be terrible. So if your baby's asking for attention, give them the attention. It's going to be good for your baby. All right, do you want to hear the lie? All right, so the lie is babies will figure out sleep by 6 months, so just wait. And if they don't get it by 6 months, just wait a little bit longer. And if they still don't get, just wait a little bit longer. Just wait a little bit longer. Just wait a little bit longer. A little bit longer. Okay, my baby is 3 years old and they're still not sleeping. Do I still have to wait? So if your baby's not sleeping well by 6 months, there are things that you can do to help, but not sleeping well by 6 months is normal. Totally normal. You don't necessarily have to put up with it, but it's not bad. If you're coping well with how much your baby is sleeping, it is not a problem. If it is a problem for you, or you think that your baby is looking really tired and sleep deprived and tired, cranky, cry all the time, then it's a problem. But don't let somebody else tell you that your baby waking is a problem if it's not really a problem, because it's normal. So things that you can do to help your baby sleep better by 6 months. And you don't have to do any of these things. You don't have to. But 6 months is, if you're going crazy and feeling really sleep deprived, these are things that you can do to help. And these are all in the arrows. So number 1, hunger. Your baby might be waking up in the middle of the night because they're hungry. Feed them. You don't want to make a decision about stopping middle of the night feeds in the middle of the night. That is a decision, a conversation that you would have with your doctor or a lactation consultant, or maybe a sleep specialist during the daytime, not in the middle of the night. In the middle of the night, if you don't know what to do, feed your baby and then plan to talk about it with someone in the morning. Things that keep a baby from sleeping is missed tired signs. So your baby has a period of time that it can be awake, called the wakeful window. And then at the end of the wakeful window is maybe a 10 to 30 minute period where they're showing tired signs. And if they have those temperament traits more on this side than this side, then it's probably a shorter window. And so you might want to look for the early tired signs like zoning out, staring off into space, glassy eyes, disinterest. If you wait for yawning and eye rubbing with an alert baby, you might miss it because the sleep window is so short. So following tired signs and helping them to have naps. And it's okay to have lots of little naps or a few big naps. The range of normal is still pretty broad. And at bedtime, I'll just go to the next one. Insufficient day sleep. So if you miss tired signs, then they're not going to get enough naps. And that can make a baby seem really cranky. And if you miss naps, then, or if you miss tired signs leading you to miss naps, then the baby's body will cope by producing more cortisol. Have you heard of cortisol, that stress hormone? So if you're tired and you have tired signs, and then you get yawning and eye rubbing, and then the window ends, but you're still awake, so you get the second wind, right? Your second wind, that's a cortisol rush. So for a baby, it makes them feel wired and tired at the same time. And for some babies, they laugh and they giggle. It's a burst of energy. And I call them cortisol gigglers. It's really funny. And then other babies, they scream and cry, and it's not so fun. And so you want to try to follow the tired signs and get enough day sleep. A too late bedtime. I just talked to a mom today, and she was putting her baby to bed at 7:30, and her baby was having early rising, waking at 5 o'clock in the morning. And I said, well, what time is the nap? And she said, from 12 to 2. And I said, so do you see tired signs? She's like, yes. I'm like, what time? What time do you see tired signs? She's like, at 6. I'm like, that makes sense. Because if the baby wakes up at 2, and you see tired signs 4 hours later, 4 hours is a really common wakeful window for a baby over 9 months. This was a 2-year-old. I'm like, 6 o'clock is your bedtime. Try that. And if that doesn't work, then let's do a consultation and we'll dig deeper. But that was just an obvious, easy to find troubleshooting spot to figure out. So too late bedtime is really common for causing increased middle of the night waking. And then there's all kinds of extra stuff like discomfort from medical issues. So tongue tie, allergies, reflux, extra stress in the home, things like that can keep a baby from sleeping. But you can't coach that stuff. You can't fix it. You have to get a medical professional to help you with that. But all these other things, the hunger, the missed tired signs, the insufficient day sleep, the too late bedtime, those are all things that we can tweak and work with to try to get some good chunks of sleep. By 6 months, a lot of babies can do 6 hours. Some can do way more than 6 hours. But by 6 months, a 6-hour stretch is pretty common. By 8 months, an 8-hour stretch is pretty common, or more. Some babies are sleeping 12 hours by 8 months. And some babies still need to eat at least once in the middle of the night until a year or later. Just trying to figure it out. So did any of this surprise you? Yes? Bernadette, unmute yourself. What surprised you? You're muted. Hover in the corner up here on where you can see your head and unmute yourself. There.
Okay, there it is.
What surprised you?
A lot of it. I'm a first-time mom, so a lot of this information I didn't know. I would say I can't even move the slide. A lot from the first truth was actually really surprising.
The 4th trimester?
Yes, I didn't know there was a 4th trimester. That was really shocking. I was like, oh no.
Okay, good. Well, there are so many ways that you guys can contact me or ask me questions. I do free 15-minute sleep assessments for everyone. Everyone gets one. So when you have your baby and you feel like everyone is telling you that you should sleep train your baby, but you remember that Tracy said, wait, that's not what you do in the first 4 months. I won't do it before 18 weeks. 18 weeks is the earliest that I would do it, and I will take it really slow and try to see if we can find some coping strategies first before jumping, because sometimes even at 18 weeks, it's still too early. One time I tried to do it before 18 weeks. It was a disaster. And one of my mentors, she's like, Tracy, what did you learn? I'm like, never doing it before 18 weeks. It's terrible. It just caused stress. And nobody needs that extra stress. So you can have a free 15-minute sleep assessment with me. You can check out my YouTube channel where I'm going to post this video that we're talking about. You please join my Facebook group, Sleep Sisters Get Quiet Nights. And in 6 months, if you're going crazy, we can have a consultation and I can help you out. So I think I have a couple more minutes for questions, right? Bernie?
Sorry, I don't know if you can hear me. I was just wondering, can I just ask a quick question really quick?
Yes.
How do you feel about using essential oils for babies to like either relax or calm, or like at what point do you think it's okay?
Okay, so I'm not an expert in oils. I've heard a lot of really good things, and I know of a lot of bad things. So when it comes to oils, I would just go forward with caution. Like for example, lavender. Lavender is supposed to help you relax, right? I think I even have a little sample of lavender. Someone gave me a whole bunch of these to pass out to people. I have a few left. They smell kind of good. My sister had to quit her job because the essential oils gave her migraines. So essential oils can have a really negative effect on someone. And with the baby, they can't necessarily tell you how they're feeling. So really pay attention to their body language to see if things are going better or not better, and go really small amounts. And if in doubt, don't. So just be careful.
And also make sure you dilute it if you do use it with coconut oil and stuff, because baby's skin is so sensitive.
Right. You can't use them straight. I was using oregano oil. I was trying to get rid of my 10-year-old's warts, and we'd been to the doctor to burn them off like 4 times, and he's screaming like, "It's not working. They just come back." And I had a niece who did oils. She's like, oregano oil. I'm like, really? Yep. And if you put it straight on the wart, they don't feel it. But if it goes beyond the wart, then it burns. I'm like, coconut oil, let's fix it. And that totally worked. I was as shocked as anybody that it totally worked. So yeah, the oils have a place, but be cautious. Carolyn.
I don't know how much of a question this is, but this is just making me wish I had, I don't know, known you or somebody 5.5 years ago when I had.
I wish I had known me 22 years ago with my first baby.
We still have to be with him till he falls asleep, and he wakes up in the night, or he comes in my room, or sometimes it's just easier to let him sleep with me instead.
How old is he?
5.5.
Okay, so I work with children up to 8 years old. You'd be surprised at how common that is. And if you didn't care and you liked it, it is not a problem. At some age, he will decide that he wants to sleep by himself. My friend co-slept with her kids, and it was around 7 years old that they decided on their own that they wanted to sleep in their own bed all night. And I'm like, 7? That's totally not me. I couldn't do that, but she loved it, and it was not a problem. She doesn't understand what I do at all. She's like, I can't believe people hire you. Like, who has problems with sleep? She just doesn't get it.
Yeah, it's mostly been okay, but now that I'm, gonna have another one soon, I'm just like, what is this gonna look like? So I'm like, I'm gonna take classes and learn how to.
There's the whole family bed idea, or you can do a gentle behavioral modification technique and make it feel secure, and you got the timing right, and you're reading body language, and help him to become more independent at bedtime, and help him to sleep in his own bed all night. And he might decide that he loves it, and those skills transfer into other self-regulation skills, and it might actually help him to be more adaptable and go with the flow in other stressful scenarios.
Right. What's interesting is I was thinking about him during this, and he definitely, from day one at the hospital, they were like, wow, he's so alert. You have such an alert baby. I'm just like, that sounds scary.
Oh, it's wonderful. There's a book called The Orchid and the Dandelion.
I'm gonna write it down.
Have you heard of it?
No.
I have it, and I thought I had it right here to grab, but it's probably upstairs on my bedside table because I'm reading it. So they compared children to an orchid versus a dandelion. A dandelion is going to thrive, sunshine and dirt. They're going to thrive, right? An orchid, on the other hand, my son just gave me an orchid for Mother's Day, needs a very particular set of circumstances. You can't water it too much, has to get the right amount of sun, or else it won't thrive. But if it thrives, it's amazing. So children are kind of like that. You might get one like a dandelion, still pretty, cute, and sunny and yellow, and water and dirt. And that, or you might have an orchid child that needs a lot of very specific sets of circumstances in order to thrive. And you just kind of figure out what kind of parenting style that child needs, and then you do it. It's worth it. So Carolyn, if you want some help with that 5-year-old, first watch. So this 5 things that keep babies from sleeping from this lie slide. I have a whole presentation that goes into each and every one of them. And I talk for an hour. Well, I think I talk for half an hour and then I answer questions for half an hour about these topics specifically. It's on my YouTube channel. So go check that out. And then if there aren't enough light bulb moments for you, you can do a free 15-minute sleep assessment. And then if you still need more, then we can do a consultation.
Awesome. I love it. I have a feeling this past year hasn't really helped. And being home, not
So
going
much
to
stress,
school again.
everything is different.
Yeah, I'm hoping once he gets into kindergarten in a couple months that consistency coming back will help. But we'll see. But I'm definitely going to join your groups and check out your YouTube for sure.
Yeah, getting good sleep before he goes to kindergarten, whether it's co-sleeping or not, is really going to help him transition into kindergarten.
Yeah. Thank you so much. And thank you for everybody listening to that.
Does anybody else have any questions before we wrap it up? All right. Well, Kimber, thank you so much for having me. I love talking to moms. I think women need women. And I don't feel like I have to go do other service projects. This is my service project. I get to help moms. It's my favorite thing to do. And then if you need more, my passion is helping moms be better moms, and getting good sleep helps you be a better mom. Mothering is just so important to me. I hope you all had a great Mother's Day.
Thank you so much, Tracy. We appreciate it. Ladies, I'm going to post on the page the 2 different groups that she talked about. And then also I'll also post the link to this video when she has that. So Tracy, thank you so much. Have a great night. Mamas, have a great night. And we'll talk to you guys soon.
All right.
Thank
Thanks,
you.
Emily.
So much,
Bye,
Tracy.
guys.
Bye.
Tracy.